Good afternoon. Now we have a very special female doctor here at the NMC Specialty Hospital, Al Nadi, and we're going to start talking about laparoscopy, minimal invasive surgery, and all the great things that come with it. Doctor, how are you?
I'm doing fine.
Good. It's a pleasure to have you with us.
Pleasure here.
Perfect. Doctor, please introduce yourself. Tell us who you are, your experience, and your role here at the NMC.
Okay. I'm Dr. Shashi Tiwari. I've been working in NMC Nahda Hospital for last 11 years. I joined NMC in 2015. I did my post-graduation from Delhi and I worked there as a junior consultant before joining here. And in 2015, I have joined this hospital and working in the department, which comprises of all specialty here. So I've got a vast experience now in UAE, almost 11 years. So I know the in and out of UAE practice and all, and the kind of patients we deal here.
Mm-hmm. You specialize in laparoscopy and general surgery, and I think this is a great topic because laparoscopy has changed the world of surgeries per se. So for those who don't know, please tell us the difference. What is the difference between a laparoscopy surgery and an open surgery?
Okay. So I've been doing both surgeries here. So there are certain criterias which fulfill for the laparoscopy surgery, and there are certain patients where we can't do laparoscopy surgery because there are contraindication to those laparoscopy surgery. So the advantage of laparoscopy surgery is that it is called as a minimal invasive because we are not opening with a big cut, which we usually use to do it. So the advantage is that we do the surgery through small holes. Either it can be 3 holes or 4 holes over the abdomen. You can go back to work easily within 7 days of your surgery. You start moving within 4 to 5 hours of the surgery. You have less pain. The cost coverage of laparoscopy is little more than the open surgery, but seeing the advantage of laparoscopy over the open surgery, the laparoscopy has taken over the world and it is very, very beneficial to the patients. So the patients are also happy to go back home on the very next day, or we treat it as a day case or maximum 1 day case. Previously in open surgery, at least patient had to stay in a hospital for 2 to 3 days, sometimes for 5 to 7 days, depending on the type of the surgeries we were doing it. They had a big scar over the abdomen, which they used to get scared looking at the scar. But now, after laparoscopy, with the small holes like 1 centimeter to 0.5 centimeter, you'll not be even able to see the scar over your body after 3 to 6 months, and you'll be welcome to wear all your swimsuit and you can do whatever you want to do.
Amazing. So big changes for sure.
Yeah.
So tell us what type of surgeries can be done through laparoscopy.
So basically here in our hospital, we usually get appendix, gallbladder, then we get hernias. So most common surgeries in our setup, we're getting all these surgeries as a laparoscopy. So I do laparoscopic cholecystectomy, I do laparoscopic appendicectomy. I also do all kinds of hernia, umbilical hernia, ventral hernia, inguinal hernias. So these are the particular surgeries which I'm doing through minimal invasive.
Okay.
And some cyst like mesenteric cyst, tomental cyst, all those things are also we are doing it.
Doctor, how do you decide when the patient will benefit more from a laparoscopy surgery or an open surgery?
Okay, so there are some criteria for laparoscopy surgery where the patient is like fit for laparoscopy, and there are certain criteria where they are not fit for laparoscopic surgery. So the most commonly is that if they have any cardiac issue where we can't, actually in laparoscopy what we do is that we put in a gas inside the abdomen and the abdomen get distended. So wherever there is a compromise on the cardiac lung function, that time we can't do laparoscopy surgery. We offer patient for a open surgery because it will be harmful for the health of the patient. Second, when there is any bleeding abnormality, in that case also we can't do laparoscopy surgery.
Okay.
In case of hernia, if the hernia is very big, laparoscopic surgery can't be done with that, where you have got a muscle diastasis or muscle weakness. Then if a person has got repeated surgeries done before and there is a large, big midline scar, that time also it is very difficult to do laparoscopic surgery. So these are the criteria where we can't offer them as a laparoscopic surgery, then we have to do an open surgery because it is not possible to do laparoscopic surgery in those people.
Okay, perfect. Good to know. Now, if a patient is coming from a laparoscopy surgery, like you say, minimal invasive, people think, oh, it's just going to be in and out, but they still need to prepare for the surgery. How they should prepare for laparoscopy surgery?
See, when they come to the hospital for the laparoscopic surgery or any kind of surgery, they go through certain blood tests. Then they go to a anesthesia, pre-anesthesia checkup where they are told what to do, what not to do. Then they come back to a staff. They are also told how to prepare, how many hours fasting is needed, what you should bring to hospital. How should you take care of yourself, like removing nail polish from your nails, because it is good to have no nail polish when you go to OT. Sometimes we tell the patient to take shower and come to the OT, and 8 hours fasting is required in surgery. So all these informations are given by our staff who are helping us to prepare them for the surgeries.
Okay, perfect. Good to know. Now, doctor, let's talk about the patients. And since you're a female doctor, we're going to take advantage and speak to the women out there, right? Because we know that some women out there don't look for the medical needs or the medical surgeries because they either embarrassed or they fearful of it. Can you please speak to the female audience and tell them that it's important for them to obviously seek for professional opinion?
For me, it has an advantage to be a female in this surgery because it's a male-dominated surgical field. So when a female is in a surgery department, is a big advantage to the female patient, because now they will be free, because usually I've seen female, they come very late to see the doctor. So I always ask them that why didn't you come early? Why are you coming so late? So their answer is always one: fear, embarrassment, and they don't want to put pressure on the family members. I'll ask them, why didn't you tell your husband? So they say, no, I didn't want them to trouble because they have got a lot of work, and I didn't want to know that I have got this disease because I'm fearful for my kids, who is going to take care of the kids and all. So I make them understand that unless you don't open up with your family members or your husband, nobody else is going to bring you to the doctor to see you. And then when you usually visit me, sometimes I find it is like, the disease has progressed to a later stage, and then you feel bad that, okay, these people have not opened to the family members because they are so embarrassed. And some of the patients, they tell me that they have been suffering with this disease, especially anorectal disease and breast disease, for like 7-8 years, but they are not telling their husband because they are not able to find any female doctors. So being a female doctors, it is very good to the patient because they are more comfortable to us. They can open to us about the disease process, and they will not have any fear in talking to us about all kind of problems they are facing. So for me, it is a big advantage to be practicing as a female surgeon, especially in this part of the world where they are more embarrassed to go to a male surgeon.
Yeah, we're grateful for you, doctor. To be honest with you, this is really nice to have, like you say, there's things that just between women, we feel comfortable talking. Okay, so you already talk about, now you're there for those female. Also talk about for the general public. Tell us how comfortable you are with the operation theater that you have here at the NMC hospital.
See, I've been here for long years now, so I have to be comfortable in my hospital. That's why I'm here, because when I go to my OT, I'm friendly to everybody, and all the nurses are here for a long time. All the OT staffs are here for a long time. So you get a kind of comfort level when you walk into a OT where you have known these people for a long time. They know your need. I know them, how good they are. We have got all the equipments which we need in our hospital. We are doing all kinds of surgery, all advanced surgeries we are doing. So we have been provided with all kind of advanced instrument by our hospital. So management has been provided with all advanced equipments, and I'm very comfortable in the OT to do surgeries.
So you have the equipment, you have the very well-trained personnel. Yeah. Pretty much this is a place that people should be very comfortable and confident knowing that everything is going to go well.
And friendly staff, that is most important, because I'm very friendly with them. They can talk whatever they want. We joke around with each other. So you have to make the environment very friendly to work in a friendly way so that you are comfortable with each other. So they get a lot of scolding from me not assisting me properly, but I'm always into teaching people like my staff how to do it, so that they are always comfortable in helping me, and they are always comfortable in asking me that, okay, what we should do, how we should do it. So being comfortable in OT is always very good to be here.
Very good, perfect. And doctor, you have over 17 years experience in different countries. tell us a highlight of your career, something that you want to share, either something that you learned that it has made a huge difference for you, or something about a patient that it stayed with you and to this day you say, I'm so grateful that happened. Or please tell us something about your experience. We always so, good to know about you guys, because you are the heroes behind the white coat.
See, I love my passion, and my passion is surgery. So for me, every day is a learning phase. Every day you learn from patient, you learn from your staff, you learn from our colleague. So I get happy when your patient sends somebody else telling you that, okay, I've been referred by this one of your patient, because I have gone to a lot of hospitals, but I was not happy. And at the end of the treatment, when they tell you that we had a very good experience in this hospital and we're very happy to come to you because we were very satisfied. So this is what gives you a bonus to work more. The empathy you show to the patient is always a plus point. Sometimes the patients are also very kind, they are very grateful, and when they send patient on their accord, and when the patient comes and tells me that I have visited so many hospitals, but I was very, very thankful that I was referred to you and I was very happy with your treatment, that makes me extremely happy.
Yeah, very good, doctor. That's very good. Congratulations on that. Okay, to finalize the interview, I'm going to ask you quick questions. They're very simple. They're about personal, a little bit of work, and then you're going to reply to me the first thing that comes to your mind. We have 60 seconds to do this.
Okay.
Are you ready, doctor?
Okay.
A surgical tool. If you could only use one laparoscopy instrument forever, which one would it be?
A good camera.
What is the biggest misconception about hernia surgery?
One biggest misconception is that, okay, my hernia repair is going to push my tummy inside. It is not like that. Especially female patient, they ask me always, okay, when you repair my hernia, will my tummy go inside? No, it is not like that.
Yeah. What is your non-negotiable stress relief ritual after a complex surgery?
As soon as you finish surgery, you run back to your OPD, because there are a lot of patients waiting for you in the OPD. So you don't even have a time to think that, okay, what has gone, what has not gone wrong. You just run to OPD and you just continue doing your OPD. Yeah.
At the end of the day, after very stressful, you have surgeries, you have patients, what do you do to unwind and make sure you reset?
Okay, so for me, once I finish my OPD or surgeries in the hospital, and when I go back, the first thing I do is that I just relax for some time, and then I head back to gym, because that is what I love doing it, because I'm a fitness freak, but not in a bad way fitness freak. I just try to build up my endurance and strength and all. So stress buster also, because I lift weight, and lifting weight is a very, very big stress buster, no doubt about it. Yeah. And secondly, I start thinking about my vacation next again after 3 to 4 months. So my vacation after 3 to 4 months for 10 days is a must for me.
Okay.
And then I get back to work again.
Yeah, you come research and recharge.
Yeah.
Perfect. Tell us about having attending conference worldwide. Which country surgical approach inspires you?
Yeah, surgical part, if you talk to me, it is India, because I have learned everything from India. It's a huge country. You have got large volume of patients. You see a lot of patients. You see a lot of complicated cases, which I have not seen here. And I have done a lot of big complicated cases in India before coming here. So for me, India is by far most country which will teach you everything you want to learn from it.
Perfect. Well, doctor, it's been a pleasure. Thank you so much.
Thank you.
We really enjoy getting to know you. Again, for all those female patients out there, we have a female surgeon in NMC Specialty Hospital. She's amazing. She's lovely. And thank you so much, doctor, for being here with us.
Thank you very much. Thank you. Lovely talking to you all.
Thank you.
Thank you.
Thank you.